Hello everyone, this is Kevin Kruse here with Texas Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. A lot of the patients that I see, I specialize in shoulder, so the most common things that I see are rotator cuff tears and shoulder arthritis. And arthritis of a joint is essentially the joint has worn out, and the analogy I give is like the tread on a tire, right? You take a car, it's got a certain amount of tread on each tire. If you drive those tires long enough, it's going to wear out. And then if you wear out the tread on a tire, then you're riding on the rims, right? And so patients that have arthritis, what it means is their joint surfaces that are covered in cartilage have worn out over time. And the more miles you put on the car, the more likely the tires are going to wear out. So it tends to be in older patients, but sometimes we do see it in young patients. And it means that the joint surfaces have worn out and you have a roughened surface, and that roughened bone-on-bone grinding is what causes your pain. And so another point I like to make to patients is that arthritis is a genetic disease. It is a disease of age, so we don't see it in 20-year-olds nearly as much as we see it in 80-year-olds, but there is a wide spectrum of people that get arthritis, and some people get it younger than others, and some people get it more severe than others. It has really little to do with what you did in your life. It has more to do with who your parents were, is what we're finding out. So don't blame yourself for something you did. It's in your DNA. But so the question is, what do you do when the joint wears out? Well, typically we always try things like medications, cortisone injections. Therapy doesn't work so great for arthritis. If you try those things and you still have a lot of pain in your shoulder, the next step is to consider replacing the joint. And replacing the joint means basically taking the joint God gave you and replacing it with metal and plastic. And arthritis is one of the main reasons why we replace joints, but the other reason is for massive rotator cuff tears or a combination of a rotator cuff tear and arthritis. So in the shoulder, it's a little bit more complex than hips and knees, where it's just arthritis that we're treating. Shoulder replacements are due to the joint wearing out, but also the rotator cuff tendon wearing out and not being able to fix it. There's two main shoulder replacements that we use. One is the standard anatomic shoulder, which is a ball and socket that looks very similar to your native shoulder. The second is the reverse shoulder, and the reverse shoulder is named reverse because the ball and socket flipped, right? And so by flipping the ball and socket, you change the mechanics of the shoulder, and that shoulder was initially made in France, actually in 1985 by a surgeon named Paul Grammont, and it was developed in order to treat patients who had a combination of arthritis and rotator cuff tears. And it was FDA approved in the United States in 2004, and it has revolutionized shoulder surgery. The reverse shoulder has. And now reverse shoulders 2 years ago superseded the standard shoulder replacements across the world in terms of volume. So it's been a radical change, and it's allowed us to basically treat a really complex problem that we didn't have a good answer for in most of our patients and treat it well. But those are the two main ways that we treat shoulder arthritis if you failed conservative treatment.